The next session will start immediately, which will be moderated by Dr. Kausa Siddharth. Thank you.
Thank you so much, sir. That was a wonderful session. And next session, we are going to have a panel discussion here. And for the panel discussion, I'm inviting Dr. Vibhu Kalyani Das on the desk. Dr. Vibhu Kalyani Das, madam, please. Dr. M.A. Mannan, Dr. Moinul Hussain, Dr. M.R. Khandokar. Dr. Khandokar, please come on the desk. Dr. Saikat Sen Gupta. Yes, sir, please. Yeah. So Dr. Saikat Sen Gupta, Dr. Vibhu Kalyani Das, Dr. M.A. Mannan, Dr. Moinul Hussain, Dr. M.R. Khandokar. And I would like to call Dr. Kausa Siddharth to moderate the session. In the morning when I saw him first, I thought you all have got a cricketer from Bangladesh actually. So yeah, and what you people have done to us, the cricketers, so it's always welcome, sir. Pleasure to have you on the stage.
Thank you so much for your nice comment about me. But I will be, most of the people they told me that I'm not like a Bangladeshi, like a Sri Lankan player. Okay. Dear expert panelists, you already introduced to the audience. And my dear audience, we are going to a very important session. It is a panel discussion. The topic of today's our topic is how do interventional pain physicians can help other physicians regarding chronic pain and cancer pain. It's a very important issue for the interventional pain specialists. Exactly. Okay. So I want to give a short introduction also to the panelists. It has been missed, I think. So should it? Okay. Okay. I ask all the panelists to introduce yourself first. Then I will go. If it is faster. Yes, it is on. Yes, sir. Now it is no.
I think I have been introduced. I am Professor Vibhu Das. I retired from the university. I retired from the university as professor and head of the department at NLS Medical College. Before that, I was in the Bangalore Institute of Neurosciences, Kolkata, where I started the pain clinic along with Professor Goswami in 87. It was the first pain clinic in this part of the country. And though I was not only the pain physician, I was also doing anesthesia and intensive care too. So now I'm retired. I have joined one of the neuro institutes, Institute of Neuroscience, Kolkata, at the Mullik Bazaar, where I get many of the patients from Bangladesh also as neurological patient, neurosurgical
Okay, thank you, madam.
So now in this, I thank Kausa for including me as one of the panelists, and thank you very much.
Thank you. Next, Saikat Sen Gupta.
Good afternoon, I'm Saikat Sen Gupta. I am a senior consultant at the Apollo Clinical Hospitals, which is in this city. I am also the professor of anesthesia at the Apollo Education Research Foundation and the chairman of the Kolkata Anesthesia Academy. I dabbled a bit with chronic pain, but I'm more of an acute pain physician today, dealing with all kinds of perioperative as well as in trauma. Thank you.
Okay, Professor Mannan.
Good afternoon. I am Dr. Mannan from Dhaka, Bangladesh. I am working there as a professor and head of the Department of Anesthesiology and ICU. In my hospital, we have got a small pain clinic where we practicing chronic pain. That's all. Thank you.
Okay, thank you. Mohammed Rahman Khan.
I'm Dr. Mohammed Rahman Khandugar, working as a anesthesiologist and assistant professor of Department of Anesthesiology and head of the department, Northern International Medical College, Dhaka. And I'm practicing pain for the last 15 years and founder member of Society of Study of Pain.
15 years, okay. Right.
I'm Professor Moinul Sen from Dhaka, Bangladesh. I'm working for the last 15 years in pain medicine. I'm doing only pain medicine. I'm not doing anesthesia. I'm working in the BSM in Bangladesh, and I'm also Vice President of the BSM. That's all.
Okay, thank you all the panelists to introduce yourself. Now we are going to our topic actually. So you are the pain specialist now. So important issue, how we can help the other discipline actually. Like it's a common field, pain. It is dealt by the orthopedician. It deals by the physiatrist. It is dealt by the cancer pain oncologist. It dealt by neurologist. It also by neurosurgeon, and also by the general physician. So a lot of discipline is involved. Psychiatry, a lot of discipline is involved with the pain management, especially the conservative treatment. So what is the need of us actually as interventional pain specialists? And what are the situations? We have to discuss this one and explore that thing. Actually, what are the disease conditions and what is the turning point where we can help the other discipline actually. They should know when they will ask the help from you. So we should have explored that thing to the all discipline because it's a new discipline. What is the condition in India and other part of world, I don't know. But in my Bangladesh, I think most of the doctors, they don't know there is a interventional pain specialty. They are in problem with their patient, sufferings. They don't know where is the dumping station, where is to be referred. So there is a way. So these are the things, these are the conditions we have to explore to the other discipline. This is our principles for today. So now I am going first to our very respected Professor M. Mannan sir. How do interventional pain physician can help the physiatrist, physical medicine discipline? Okay, how we can help them.
Thank you, Dr. Karsal. It's a great pleasure and honor for me to be here. The thing which is asked is how we can help the physiatrist. This is as a pain specialist. The patients usually first go to the physiatrist and they get their physiotherapy, then medical treatment, and usually 70 to 80 or 60 to 70% patients, they become well and they get good treatment and they're all right. So by repeated treatment, medical treatment, they can live their life normally. But what happens, 20 to 30% patients, they become chronic and they become so much problem with their life, they are not to live their normal life. So what we should find out in those patients, for any patient, thorough history, then we should have thorough physical examination and some laboratory investigations, and find out the cause. What's the reason the patient is suffering for such a chronic and long time? So, find out the cause, then we can intervene the cause and we can treat the cause. In those cases, we get good benefit. For example, low back pain patients, they get treatment, they get physiotherapy and doing well, but few patients, they do not improve. So, after investigation, we can find that the patient may have facet arthropathy or SI joint arthropathy or some disc problems. So if we can diagnose properly with the investigations and proper examinations, and if we interfere in that root level of the cause, the patient gets better. So this is the way we can help the patient.
Yes, thank you. Thank you for your nice elaboration about this. So he wants to say actually physiatrist is a physical medicine department. It's a very common entry point of the pain patient actually. Not for the cancer pain, it is for the spine pain or multiple joints pains, musculoskeletal pain, etc., etc. It's the entry point actually. So all the patients goes to there. They are not all time happy with their patients. But few patients, though we have not the very specific statistics analysis that how many patients are refractory to their treatment, but it is guessed that about 20–30% patients, their patients, they are not happy actually. So this group of patients needs some new techniques, treatment. That is the you were saying. What is the way of treatment? That is identify actually the source from where the pain is coming. Like low back pain, there are a lot of causes. It can be facet. He mentioned very nicely. The facet joint pain, it can be from facets. It can be from SI joints. It can be from the disc also. So identify fast from where it has come. Then treat it very specifically. This is the role of the interventional pain specialist. Thank you so much for your nice elaboration. So,
Dr. Sada, if I can just add
yes, sure.
to what you have said.
Yeah.
I think one of the places where, as an interventional specialist, we can definitely work with the physiatrist is depending upon what kind of a setup you are. If you are in a one umbrella setup where there is a physiatrist and you, it works two ways. You can tell them that these are the patients which might need interventional pain interventions, and get those patients to yourself, treat them and send them back. The other way would be that the gateway of the patient could be you as a pain physician. You do certain interventions and you know that these patients do need physical rehabilitation for a better outcome.
Right.
And so then these patients go to the physiatrist. So you kind of work as a team, or I think there are many centers who today, physiatrists who are not doing pain interventions are being trained